This is Ben. Ben came to see me with a sore shoulder. He was getting pain in not only unloaded movements but also loaded movements when he was training at the gym. After asking Ben some questions about his shoulder, we moved on to perform some manual muscle tests to see if we could provoke Ben's pain. This could be done in a number of positions, so we then moved into some movement-based testing to see if we could find where the fault began. Here you'll see Ben performing an active prone lying shoulder extension test. What we're looking for here is that Ben can show 50 degrees of extension at the shoulder, and as you can see in this video, Ben's failing to do that and only showing 25 degrees of shoulder extension. You'll now see that we're performing the same test with me performing the movement for Ben passively. In this scenario, we can clearly see that Ben now has 50 degrees of extension at the shoulder, except he just wasn't able to get there himself. This is the indicator that we use that really shows that there is a motor control deficit within Ben, and one of the contributing factors to his pain is his inability to access the true ranges of extension that we can clearly see his shoulder has. We now move on to a prone lying active external rotation test of the shoulder. In this example, you can see that Ben has 50 degrees of external range of motion. The criteria we're looking for is 90 degrees of external rotation, which shows that Ben's not meeting the required mark. You can now see in the passive example of external rotation that Ben not only has 90 degrees, but he even has more movement, totaling 110 degrees of rotation through the shoulder. This really highlights again that Ben has some motor control limitations through the shoulder, as he is unable to access the full movement that we can now see this shoulder is capable of showing. Next, we're taking a look at Ben's ability to control motion through his thoracic spine in both extension and rotation, which has a very tight-knit relationship with his scapulothoracic region. As you can see, Ben's ability to express extension and rotation to the left is 25 degrees, whereas if we can compare that to what he can show on his right hand side, you'll see that he can show 55 degrees. This clearly shows a deficit between left and right side, which makes sense as Ben's complaining of his symptoms on the left shoulder. We're now going to look at the same test performed passively. And what we need to notice on this video is that Ben's ability to express that extension and rotation passively now meets our criteria of 50 degrees and is on the same level of rotation that he can show on his right side, being 55 degrees. You will see that there is no significant difference between active range of motion and passive range of motion to the right. However, there is a significant difference of 30 degrees to the left. This is what indicates our motor control deficit contributing to Ben's shoulder pain. What we're now doing is instructing Ben to develop the required motor control through this left shoulder. We do this by providing Ben's body with a problem where the solution can only be achieved utilizing the deficits that we have identified during assessment. As you can see here, Ben employs a pushing strategy to achieve the roll. He then moves on to try to employ a pulling strategy. These are the two most common mistakes we see patients make when trying to achieve a rolling pattern, and this is why we must develop their motor control to fix this. I'm now giving Ben instructions that I don't want him to use a pushing or pulling strategy, and that I'd like to see him use his shoulder to create torque and create that rotation that's required to achieve our roll. As you can see, Ben is now using sufficient range of shoulder extension, but he's still not able to complete the roll. You can see that he gets stuck and cannot roll any further. I now remind Ben that I'd like him to show more extension and rotation using his neck, and what you can see is that the roll now starts to take some shape and that we can achieve a successful outcome. So, what have we changed? Here's Ben's external rotation testing after our rolls. You can now see he clearly has 100 degrees of range of motion. Compare that to his 50 degrees that he showed before intervention, and we now have the same amount in active and passive range of motion. Looking at shoulder extension, Ben now shows 50 degrees of extension when compared to his pre-roll mark of 25 degrees. Now comparing that to the passive range of motion, you can see that they are in fact the same. Lastly, we'll take a look at thoracic rotation. You can now see that Ben is showing 55 degrees of rotation, comparing that to his pre-roll mark of 25 degrees, and compare that again to his passive mark of 55 degrees. Our post-intervention testing confirms that there has been sufficient levels of motor control development for Ben. We then went and checked our pain provocation tests that we completed at the start, and Ben was finding that there was significantly less pain experienced in his shoulder than there was before the rolling patterns.
So that concludes our sneak peek into literally a very small section of the MoveWELL system. I know you all would have gained a lot out of seeing firsthand how easy it can be to improve someone's function and overall health. For those who are wanting more information, I would love it if you would join our private Facebook group, where I'll be continually uploading content to help you with all your symptoms and educating you on how MoveWELL can be the solution that you are looking for. So what are you waiting for? The links are below. Click to join and start to move well today.